Dropping, the coronavirus growing, and now we have to start figuring in the threat from the flu season. Good evening, I'm Samantha Jones.
And I'm Corey Stark. Doctors say what we saw in the spring can't compare to now.
We have a lot of different headwinds going into this wave that we didn't have in the previous wave, which is what makes us even more concerned about where this is all going to take us.
News 4 has team coverage in the spike in cases and the steps being taken to slow the spread of the coronavirus. We begin tonight with Emma Hogue outside Barnes Jewish Hospital.
Right now, a combined 412 people are in area hospitals fighting COVID-19. Local leaders tell me we have a small window of time to correct this growing trend before they consider more restrictions, including the possibility of another stay-at-home order.
He was in multi-organ failure, septic shock. He had a fever of over 105. So they couldn't keep him cool enough.
This is Kelly Krupinski's husband, Scott, in early April. She says the 56-year-old was on a ventilator in a medically induced coma on the brink of death.
If he went into heart failure, that they would not resuscitate him. He was that bad.
But after 59 grueling days apart, this couple, married for 24 years, was reunited. Scott made a recovery Kelly calls a miracle, one even doctors couldn't believe.
Nurses were coming in to go by and look through his window because they were just shocked that he was still with us.
Though her husband's back at their O'Fallon, Missouri home, hospital admissions metro-wide are rising rapidly. The St. Louis Regional Pandemic Task Force reports the 7-day moving average of hospital admissions is at 55. Digging deeper, News 4 discovered we haven't seen a number that high since April 9th.
The trend, the 7-day average, is going up, and that's concerning for us.
Some folks, I believe, have let their guard down.
St. Louis Mayor Lyda Krewson and St. Louis County Executive Sam Page say contact tracing shows the majority of new cases come from house parties and family gatherings. I asked if another stay-at-home order is ahead.
Right now we're seeing an increase, but it's not doubling every 2.5 days like it was back in April.
Everything is on the table, but frankly, even if we had a stay-at-home order, how would we prevent you from having a house party?
After months of rehab, Krupinski's husband is back to working part-time. She hopes their story serves as a warning to others.
I do know that this virus is out there and it's real and you can protect yourself.
Now, this really all boils down to what health officials have been stressing for months. That means wearing your mask, washing your hands, and keeping a safe social distance. Both Krewson and Page telling me what action we take now will impact whether we have more restrictions in the coming weeks. Reporting from Barnes Jewish Hospital tonight, Emma Hogue, News 4.